Welcome to Med Concepts. Today we are going to master the median nerve in just a few minutes. Let's begin. The median nerve is known as the nerve of precision grip. It is formed by contributions from both the lateral and medial cords of the brachial plexus, with a root value of C5 to T1. A simple way to remember it is median means middle, because it travels in the middle of the upper limb. Next, let's look at its course. The median nerve passes through the arm, enters the cubital fossa, passes between the two heads of pronator teres, travels between the flexor digitorum superficialis and flexor digitorum profundus, then enters the hand through the carpal tunnel. Remember the mnemonic. A cool person finds friends happily. Arm, cubital fossa, pronator teres, FDS/FDP, carpal tunnel, hand. Now for the motor supply. The median nerve supplies almost all the flexor muscles of the forearm, except flexor carpi ulnaris and the medial half of flexor digitorum profundus. The mnemonic is all flexors except FCU and medial FDP. In the hand, remember the famous LOAF muscles, L for the lateral two lumbricals, O for opponens pollicis, A for abductor pollicis brevis, and F for the superficial head of flexor pollicis brevis. For sensory supply, the median nerve provides sensation to the lateral palm, the palmar surface of the lateral 3.5 digits, and the fingertips on the dorsal surface of the same 3.5 digits. A useful mnemonic is 3.5 in front, 3.5 fingertips behind. Clinically, compression of the median nerve in the carpal tunnel causes carpal tunnel syndrome, leading to numbness, then a muscle wasting and weak thumb opposition. A high lesion of the median nerve results in the hand of benediction, while a low lesion at the wrist causes the ape thumb deformity. Remember, benediction at bend, ape at wrist. Finally, the OK sign tests the anterior interosseous nerve, a motor branch of the median nerve. If the patient cannot make a proper tip-to-tip OK sign, think of an AIN lesion. That's the median nerve in just a few minutes. If you found this lecture helpful, don't forget to like, share, subscribe to Med Concepts, and stay tuned for more high-yield MBBS anatomy lectures.